From questions about the booster shot to an urgent warning from the CDC today about COVID-19 and getting more pregnant women vaccinated. That's where we're going to start today with Infectious Disease Specialist Dr. Ruth Berggren with the Long School of Medicine at UT Health San Antonio. Doctor, good to see you. Let's talk about why the CDC is now taking this step to say, pregnant women, you need to get vaccinated.
Well, the reason, simply speaking, is we've seen a lot of pregnant women get hospitalized. They've gotten unnecessarily seriously ill, and they are vulnerable. They are more vulnerable than the average person to having a bad outcome from COVID-19. And there have been over 600 deaths in pregnant women. We don't ever want to see a pregnant woman die of a preventable infectious disease. That's the first part. The second part is we have tons of data showing that the vaccine can be given safely to pregnant women, and there's no adversity to either the mom or the baby. So it's a wonderful thing to do. This is not a live vaccine, and it is the best way to prevent a mom from getting unnecessarily sick or unnecessarily dying.
For mothers out there, for pregnant women who are considering, okay, I want to make that decision, I want to get this vaccine, is there a point in their pregnancy that is the right time or the suggested time to do so?
There is no limitation on when in pregnancy you can get the vaccine. And so the answer to your question really is the sooner the better.
On our newscast over the last few days, there's been a lot of talk about a winter surge. We've seen graphs that show, that it looks like the number of cases will go up, around the holidays and into the start of the next year. How concerned are you about a winter surge? And is it too late to avoid it?
So I'm very concerned about it, Steve, because of all of the school children that are vaccine eligible but have not yet been vaccinated. We're sending kids to school every day. There's inconsistent practice of masking. A lot of kids are unvaccinated, and so it's just a setup for this to spread. However, it does not have to. We don't have to just sit here and take it. Right? We can do something about it. And we know that the way to get out of this pandemic is really through vaccination and judicious use of masking. We've got to do it so we don't have to see those numbers go up. We don't have to make that prophecy come true. We can do the opposite and we can see cases come down, but we've got to get over our fear of vaccine and get the needles into people's arms. That's what we need to do.
There are booster shots available in San Antonio now, and there are some questions, though, about people who have received the Moderna vaccination. We've heard from some viewers who said, my doctor told me that I need a third dose of Moderna for whatever conditions that they may have, but there's a difference in a third dose versus a booster, correct?
Right. So lots of people are confused, and I get why. Sometime back, it was clear that people who have seriously immunocompromising conditions, like they had an organ transplant, well, they don't make enough of an immune response from just 2 doses of vaccine. And so those people who have those immunocompromising conditions need 3 doses. And that third dose for them is not actually a booster. It's actually a required third dose to get to a level of protection that's meaningful. So whether you had Pfizer or you had Moderna, if you are immunocompromised by a certain list of conditions or something determined by your doctor, you should have your third dose. And that third dose for immunocompromised people can be given a month after the second dose.
Even though the booster shot for Moderna and for Johnson & Johnson hasn't been approved yet, it's still safe.
That is absolutely correct. And it was very clear from the get-go. These are for people with mRNA vaccines. So Pfizer or Moderna, if you are an immunocompromised person, you need 3 doses, not 2. And that third dose for you is not considered a booster. It's a third dose. We have no such recommendations for the Johnson & Johnson. So I want to be very clear about what I'm talking about.
Yeah, the J&J folks still waiting for more information on that. Is there any difference in the actual vaccine itself? What is in that needle from the booster to the third dose? Any difference?
So far, no. At this time, when you're going in for a booster, let's say that you're one of those over 65-year-old people or someone with a heart condition, for instance, that is on the list of who needs a booster. When you go in, you are getting the exact same vaccine that you had the first time around. We don't have any updated or Delta-specific boosters. That may come in the future, but right now the boosters are all the same shot that you had before, and that's with Pfizer only, because you're right, and you mentioned it before, Moderna did not get approval yet for a booster.
Now, a lot of let's talk about Pfizer and the vaccine for children who aren't eligible right now. The first data was turned over to the CDC. I'm sure you've looked at the early results of what has been seen so far. Do you find what they've turned over promising?
Yes, and I continue to remain hopeful that sometime this fall, we're hoping for by the end of the month of October that we'll get an approval, an emergency use authorization for kids 5 to 11 to be getting an mRNA vaccine, and it looks like the dosing will be lower for the younger kids than it is for older kids and adults.
And that's still expected to be 2 shots, is that correct?
Yes.
Okay. 2 shots. And also, we should point out, we talked to you about this last week, but I know we're still getting questions about it. Safe to get the vaccine and the flu shot at the same time?
Absolutely. Don't be afraid of doing that. It's approved, and there's no scientific reason why it shouldn't be okay. I believe the worst that's going to happen to you is that instead of 1 sore arm, you'll have 2 sore arms. You'll probably feel achy no matter what, but that means your immune system is functioning and it's doing its work, and the achiness will not last long.
I always appreciate the fact that Dr. Ruth Berggren is not afraid to take the same question over and over, because we get those questions and it's all in the interest of information and getting it out there. So, Doctor, thank you for your time.
You bet. Thanks.
We'll see you next week, and we'll be right back.